Hey everyone, welcome to today's Thursday Live, and I am so glad you're here with me today. So, if you're just joining us, drop your name in the comment section. Tell me where you're watching from because I've always loved to see who is tuning in. My name is Loretta Ngbebi. So, today is a very special day, and on the 14th of April was World Chagas Disease Day, and I already know some of you are sitting there, going through your what's Chagas? What does that mean? I've never heard of that today, and and that is exactly the problem. So that's why we're talking about it today. So this year theme is fighting the silent epidemic of Chagas disease, and the word silent is the most important word in that theme because this is a disease that can live inside your body for years, for years, sometimes decades, without you even feeling anything, without any warning signs. And by the time you find out, it may have already done serious damage. So today we are going to break it all down, and what Chagas disease is all about, and how it spreads, who is at risk, what it does to the body, and how you find out if you have it, to know how it's being treated and what we can all do about it. And I promise you, by the time we are done, you will understand this disease completely. Now, um, before we talk about Chagas, what's Chagas disease is, I want to tell you where it came from because I think understanding the story behind a disease helps to make it, to make it more sense. And okay, in the year 1909, a young Brazilian doctor called Carlos Ribeiro Justiniano name was Jagas, and was working in a small rural community in Brazil. He was there to help control malaria, but while he was there, he kept noticing something strange. People in the community were always getting sick with symptoms, that did not even match malaria. And so they had fevers, swollen glands, and some of them had a very peculiar swelling around one eye. And so this doctor, Dr. Jagger, started investigating. So he discovered that there was a bug, a specific blood sucking insect that lived in the cracks of mold walls of houses in that community. So he studied this bug and found a parasite living inside it. And he then confirmed that the parasite was being passed from the bug to humans and causing a disease. And so on the 14th of April 1909, he, di- um, he diagnosed the very first human case, a little 2-year-old girl called Berenice. And so that is why we observed what Chagas Day on the 14th of April every year to mark that moment. Now, what is remarkable about Dr. Chagas is that he did something no other scientist had done before or since. Like, he discovered the disease, he identified the parasites causing it, and then he found the insects transmitting it all by himself, all at the same time. And that is an extraordinary achievement in the history of medicine. But here is the painful irony. Despite that, despite that, well, early discovery in 1909, for over 100 years, this disease was largely ignored. It did not get the research funding it needed. It did not get the media attention it deserved. It was brushed aside as a disease of poor people in remote areas of Latin America, and because poor people often do not have political power or a loud voice, so nobody was even fighting for them loudly enough. So it was only in the 2019 that the World Health Organization officially recognized World Chagas Disease Day. The first global observance was in 2020. So this is actually a relatively young observance, even though the disease has been around for over 100 years. And the fact that we are here today talking about it, that matters because every time someone learns about Chaga disease, every time someone shares this information, but we are chipping away, at that wall of silence, and that is how That is how epidemics get defeated. Now, what is Chagas disease? Okay, Chagas disease is also known as American trypanosomiasis. It is a disease caused by parasites, and the name of the parasite is Trypanosoma cruzi, named after Dr. Chagas' mentor, Oswaldo Cruz. Yes, so Oswaldo Cruz was the mentor of, was the person that Dr. Chagas mentor. So now, I know that name sounds complicated, so I'll just call it T Cruz for short. Sorry, T Cruzy for short. So, you know, a parasite, in case you're not sure what that means, is a tiny living organism that lives inside a host, which can be a human, an animal or an insect, and it survives by feeding off the host. And some parasites are harmless, but C. cruzi is not harmless at all. Once it gets into the human body, like it involves cells, especially the cells of the heart and the digestive system, and starts multiplying, and over time, that's multiplication and the body's response to it causes, serious damage. Now, Chagas disease is classified by the World Health Organization, as a neglected tropical disease, which NTD for short. What does neglected mean in this context? It means that despite the fact that millions of people are affected, the disease has historically, not um, not receive the research attention and the funding, the policy focus, or the public awareness that it deserves. It has been neglected because the people it mainly affects are the poor rural communities, or and so just because they do not often have the platform to demand better. So right now, it is estimated that between 6 and 7 million people worldwide are living with Chagas disease, and that is 6 to 7 million people. About 10,000 people die from it every year, like every single year, and more than 100 million people are at risk of getting infected. Now, when people hear these numbers, they sometimes assume this is a disease, that only exists in Latin America. And while it is true that Chagas disease started there and is most common in 21 countries, 21 countries in continental Latin America, countries like Brazil, Bolivia, Colombia, Argentina, Mexico, and many others, because of migration and people moving around the world. So the disease has now been found in over 44 countries, and that includes countries in North America, Europe, Australia, Japan, and yes, increasingly in parts of Africa too. So this is not a disease that is far away from us. This is a global issue, and it is growing. Now, how does Chagas disease spread? Okay, this is one of the most important section of the most important sections of today's section, because understanding how Chagas spreads is the first step to preventing it. So I want to break this down very clearly. There are several ways of Chagas disease can be transmitted. So I'm going to take them one by one. Now, the first and most common way is through the kissing bug. Okay, some of you wondering what's the kissing bug. Okay, now the kissing bug is the insect responsible for spreading Chagas disease in most cases, especially in Latin America. Its scientific name is the triatomine bug, but people call it the kissing bug because it tends to bite people on or near the face. Yes, near the face, around the lips, mouth, eyes, and why that is why people are sleeping at night. So we tend to bite around those areas I just mentioned. Now, this bug does not just bite you and directly inject the parasite. That is not how it works. What happens is this: the bug comes out at night when you're asleep. It bites you to feed on your blood, and after feeding, it defecates. It poops near the bite wound, and the parasite secrecy lives in the box droppings. So when you wake up and unconsciously scratch the bite area, You rub those droppings into the wound, or you might even rub them in your eyes or touch your mouth before even washing your hands. And so that is how the parasites get into your body. I know that sounds very uncomfortable to hear, but this is real, and understanding it helps us know what to do about it. Now, this bug lives in specific environments, like I mentioned, and it loves to hide in cracked mold walls, thatched roofs, under rocks, in animal pans and chicken coops, and in any poorly constructed structure with gaps and hiding spots. So it comes out at night, feeds and hides again by dawn. So people who live in mud houses, especially in rural areas where the bug is present, are at higher risk. Now, the second way is through food and drinks. Okay, this is called oral transmission, and it is responsible for more and more cases, especially in outbreaks. If food or drinks are contaminated with the droppings of body parts of infected triatomine bugs, or with the bodily fluids of infected animals, that bug has also fed home. And someone eats or drink that contaminated food or drink, it can become infected. There have been documented outbreaks linked to contaminated sugar cane juice, fresh fruit juice, palm wine, and other raw foods in various parts of Latin America. So this is a very real route of transmission, and it has caused some quite large outbreaks in community settings. And now the third way is through blood transfusion. Okay, now if a person who has Chagas disease donates blood and that blood is given to someone else without being screened for secrecy, the parasite can be passed on, and this is why it is so important, that for blood banks, that it is so important for blood banks to screen donations for Chagas disease, especially in the endemic areas and in countries that receive migrants from those areas. And fourthly, through organ transplantation. Now, if someone with Chagas disease donates a solid organ like a kidney, heart, or liver, and that organ is transplanted into another person, the recipient can also become infected. And again, proper screening before transplantation is critical. And so the fifth way is through the mother and child, what is called the congenital transmission. Now, a pregnant woman who has Chagas disease, even if she has no symptoms and does not know she is infected, can pass the parasite to her baby during pregnancy or even during childbirth. The baby is then born already infected. So this is called the congenital Chagas disease. Now, this is is a very significant route of transmission, especially now that vector control programs have reduced kissing bug transmission in many areas in some countries and regions. Congenital transmission is now the primary way new infections are happening. So, and this is part of why this year's team focuses on women, not because Chagas is a woman's disease, but because addressing transmission during pregnancy, is one of the most powerful ways we can stop this cycle. We'll talk more about this later. Now, the sixth way is through laboratory accidents. Now, people who work in laboratories handling blood samples or leave parasites can become infected if there is an accidental exposure. Now, this is rare because it has happened, and that is why proper lab safety protocols are essential. Now, one thing I really want to make clear is what Chagas disease does not spread through. You cannot get Chagas disease from casual contacts with an infected person, no, not possible. And you cannot get it from hugging them, you cannot get it from shaking hands with them, sitting close to them, and then sitting with them, dining with them, sharing same spoon or cup with them, you know, or even breathing the same air with them. No. Chagas disease is not contagious in the way that a cold or flu is contagious. And so understanding this is very important because it directly affects how we treat people who are living with the disease. Now, I'm going to talk about how Chagas disease affects the body. Okay, now, um, the because because this is the part that really explains why it is called a silent epidemic. Now, Chagas disease has two main phases, and the acute phase, we have the acute phase and the chronic phase, and they are very different from each other. Now, the acute phase is what happens right after infection. In this early stage, the parasite has just entered the body and is multiplying rapidly in the bloodstream. So this phase lasts for a few weeks to a few months. Now, here's the thing. Most people, like a large majority, have no symptoms at all during the acute phase. Like nothing at all. They feel perfectly okay, fine, like they have no idea anything has entered their body. But this is one of the main reasons the disease stays hidden for so long. Some people do develop symptoms in the acute phase, but these symptoms are very general and easy to mistake for other common illness, like things like fever, headache, tiredness and fatigue, muscle pain, swollen lymph nodes. So these are the small glands you can sometimes feel in your neck, armpit or brain. And so some people also develop a rash or a swelling at the sites of the bites. But the one sign that is somewhat unique to Chagas disease is called Romania sign. Now, this is painless, soft swelling around one eye, specifically the eye on the same side as where the parasite entered the body. So, if you see a person with unexplained one side eye swelling, especially in an area where the kissing bug is known to exist, Chagas disease should be considered. But even the sign, again, if even the sign is always present because many people go through the acute phase, with absolutely no obvious signs. So, should in case you see someone, it's advisable you can just tell the person to go run a test to know what is actually wrong with his or her eye. So, if Chagas disease is diagnosed during the acute phase and treatment is started immediately, the Chagas of completely curing the disease are very high. And so this is the best time to catch it, and this is why awareness matters so much, because if people know about Chagas and you know, know to get tested when they think they may have been exposed, they can be treated early and fully cured. Not, but because most people have no symptoms, most people do not get tested, and so they move into the next phase without even knowing. So now I'm going to talk about the intermediate phase. Now, after the acute phase, about 60 to 70% of infected people enter what is called the indeterminate phase. In this phase, the person has no symptoms. They feel completely normal, they look healthy, they can go to work, take care of their family, do everything they normally do with absolutely no sign that anything is wrong. But here's what is happening underneath. Now, the parasite is no longer freely circulating in the blood, in the blood in large numbers. Instead, it has gone into hiding, like it has buried itself into the cells of specific organs, mainly the heart muscle and the muscles of the digestive tract. And then, very slowly and very quietly, it is causing inflammation and damage, cell by cell, year by year. So this phase can last for years, sometimes 10 years, sometimes 20 years, sometimes a person can be in the indeterminate phase their entire life and never progress to the next stage. But for a significant number of people, eventually damage becomes too much and then the chronic phase begins. So, for the chronic phase, is when the long-term damage from Chagas disease finally becomes visible and it is serious. And about 30% of people with chronic Chagas disease develop heart problems, and this is called Chagas cardiomyopathy. The heart muscle has been weakened and damaged over time by the parasite and by the body's own immune response, trying to fight it. And And so the heart becomes enlarged, weak, and unable to pump blood efficiently. Now, what does this feel like? The person may start noticing that they get tired very easily. They might just do little work or maybe just do something minor, and before you know it, they complain that they're tired already. So even from small activities, like I mentioned, they may feel breathless, struggling to breathe, even when they are not doing anything serious. So they may feel their hearts, their heart beating irregularly, fluttering, racing, or skipping beats. So they may have chest pain. They may faint. There are some that faint, and they may even have swollen legs because the heart is not pumping blood properly. So in severe cases, Chagas can lead to heart failure. That is Chagas cardiomyopathy, like I said, can lead to heart failure, can lead to stroke or sudden cardiac death. And this means a person can collapse and die suddenly because the heart simply stops working properly. And because the person often did not know they had Chagas disease, this sudden death comes as a complete shock to the family. And it's um, and this is truly tragic because these are people who felt fine for years, like who had no idea, and then suddenly their heart just gives out. So, and um, another 10% of people with chronic Chagas develop serious problems in the digestive system, and the parasite damages the nerves that control the muscles of the esophagus, and so that is the tube that carries food from your mouth to your stomach, and the colon, the large intestine. When these nerves are damaged, the organs stop working properly and they become enlarged. So when the esophagus is enlarged, a condition um, called megaesophagus, the person has difficulty, swallowing. Food feels like it is getting stuck. Eating becomes painful and difficult. So people can lose a lot of weight because they struggle to eat. So when the colon is enlarged, which is called the megacolon, the the person suffers from severe constipation, and so we are not talking about the normal occasional constipation. We're talking about cases where a person cannot pass stool for many days, even weeks, and so the abdomen becomes very distended and painful. In several cases, surgery may be needed, and so these are life-changing, quality of life destroying complications, all coming from a parasite that enter the body silently, causing um, they enter the body that no like cause no symptoms for years and then unleash damage that can never be fully reversed. So, and some people that develop um, complications to problems affecting the brain and the nervous system, and this is less common but it does happen, yes, particularly in people whose immune systems are weakened. For example, people living with hiv who also have chagas disease. Now I want to talk about how chagas disease affects different groups of people differently because it does not affect everyone the same way. So let's talk about children particularly. Now, when a child is infected, either through a bug bite or through congenital transmission, their young immune system responds to the parasite differently from an adult. In children, the acute phase can sometimes be more severe, and there have been cases of children developing serious complications, including heart inflammation and brain swelling during the acute phase, which can be fatal if not treated promptly. So, but the good news about children is that treatment is highly effective when given early. Children who are diagnosed and treated in the early stages have very high cure rates, and this is why screening babies um, born to mothers with Chagas disease is so important if the baby is identified at birth and treated. And so they have an excellent chance of completely normal and living an healthy life. And for pregnant women, I want to talk about it because this is the only group that matters, because pregnancy creates a very specific vulnerability that is important to understand. Now, now, um, when a woman is pregnant, her immune system naturally becomes somewhat suppressed, and this is actually a normal and necessary part of pregnancy. The immune system has to be a little less aggressive so it does not attack the baby. Now, who is genetically different from the mother? But this suppression also means the immune system is less able to keep the parasites in check. And in some pregnant women with Chagas disease, the acute phase can reactivate. It can reactivate, meaning the parasite that was dormant start becoming more active again during pregnancy, and this can make the pregnancy to be at risk, like at high risk. And so then there is the issue of congenital transmission. About 3 to 5% of pregnancies where the mother has Chagas disease will result in the baby being born infected. Now, 3 to 5 percent, might sound small, but when you think about the number of women with Chagas disease worldwide, that adds up to thousands of babies every year being born already carrying this parasite. If a baby is born with congenital Chagas and is not identified and treated, that baby will grow up carrying the parasite and they will likely go through childhood feeling fine. Then they become adults, and then they enter their 30s, 40s, 50s, and then the damage to their heart and digestive system starts to show. And so they develop heart failure, they struggle to swallow, and all of this tracing back to the day they were born. So now, here's what I really want you to hear. This is preventable, and if a woman is tested for Chagas disease before or during pregnancy, if she's infected, she can be treated before becoming pregnant, and that treatment is almost 100% effective in preventing her from passing it to her baby. Almost completely preventable. Medicine exists, yes, but the knowledge, even the knowledge exists, and but what is missing is the screening and the awareness. Now, I'm going to talk about the people living with HIV. People who are living with HIV and also have Chagas disease face a much more dangerous situation. HIV weakens the immune system significantly, and it is the immune system that keeps the Chagas parasite in check in the chronic indeterminate phase. And so, when the immune system is weakened by HIV, the parasite can reactivate, and it comes out of its hiding place in the cells and starts multiplying aggressively again. And this can cause a very severe form of Chagas disease called Chagas disease reactivation. And so the most dangerous form of this is Chagas encephalitis, infection of the brain by the parasite. Now, this is life-threatening. The person may become may may develop severe headaches, confusion, seizures, and if not treated quickly, they can die or be left with permanent neuro, um, they can left permanent damage. And so, for this reason, people living with HIV in areas where Chagas disease is present, should be screened for T cruising. And if they are found to be positive, they need careful monitoring and appropriate management. Now, for the elderly people, as people age, their immune system naturally become less strong. So for an elderly person who has been living with chronic Chagas disease in the indeterminate phase, the weakening immune system that comes with old age can allow the parasite, to become more active. Heart complications that were mild or manageable in the middle age can become much more serious in old age. So this is another reason why knowing your status early is so important. so that appropriate care and monitoring can be put in place as you age. And also for people who receive blood transfusion or organ transplant. Now, if someone who needs blood transfusion or an organ transplant unknowingly receive blood or an organ from a person with Chagas disease, they can become infected, and because the recipient also has a suppressed immune system, especially after an organ transplant where they take medication to prevent rejection. So the disease can progress quickly and severely, and this is a real risk healthcare. This is a real risk that healthcare systems in endemic areas and in countries with Chagas positive migrant populations need to take seriously by putting proper screening in place. And also for diagnosis and treatment. Now, how do you find out if you have Chagas disease, and what do you do? What do you do if you do, like if you are aware? Um, there are different ways to diagnose Chagas disease depending on what phase the person is in. So, in the acute phase, the parasite is present in large numbers in the bloodstream. So, a doctor can take a blood sample and look at it under a microscope. You can actually see the parasite directly, and this is called microscopy. So, it is simple and very effective in the acute phase. But in the chronic phase, the parasite is no longer in large numbers in the blood. It is hiding in the tissues, so microscopy alone is not enough. And in the chronic phase, diagnosis is done through blood tests called the serological tests. And these tests do not look for a parasite itself. They look for antibodies, and antibodies are proteins that your immune system produces to fight specific infections. So if your blood contains antibodies against T. cruzi, your immune system has encountered these parasites. So because these tests can sometimes give false positive results, meaning they say you have the infection when you actually do not. But the World Health Organization recommends using at least two different serological tests to confirm a diagnosis of chronic Chagas disease. So only when both tests come back positive in the diagnosis confirmed. So there are also never diagnostic tools being developed. For example, there are raw rapid diagnostic tests similar to the kind of rapid tests used for malaria or COVID, and that can give results in a shorter time. So these are especially useful in low resource settings and in communities where people do not have easy access to full laboratory facilities. So for babies born to mothers with Chagas disease, diagnosis is done differently, and so the standard antibody test cannot be um, used in newborns because the baby may carry the mother's antibodies in their blood for up to 9 months after birth. So the positive antibody tests, in a newborn just be reflecting might just be reflecting the mother's antibodies, not an actual infection, but instead a special test called PCR, which stand for polymerase chain reaction. So, and it's used to directly detect the parasite genetic material in the baby's blood. So this test is more sensitive and can tell whether the baby is actually infected. And for the treatment, there are two drugs used to treat Chagas disease. The first is called benzimidazole, benzimidazole, and the second is called Nifotimux. I call it again Nifotimux. Both of these drugs work by killing the T. cruzi parasites inside the body. Now, how effective are these drugs? It depends heavily on when treatment is started. So, in children, especially in the acute phase or in early infection, treatment with these drugs is highly effective, with cure rates that can be very high in adults in the acute phase. So treatment is also very effective and can lead to a complete cure in many cases. And in adults, in the chronic phase, things are more complicated. The drugs can still kill the parasites. They can stop the disease from progressing further. They can reduce the risks of the person developing cardiac or digestive complications, but they cannot reverse damage that has already been done. So if the heart has already been damaged, that damage is permanent. The medication can slow things down, but it cannot give you back what has already been destroyed. So this is again the critical argument for early detection. But drugs, both drugs do not have side effects. Common ones include nausea, vomiting, loss of appetite, rash, dizziness, and in some cases, more serious allergic reactions. So that is why treatment must always be supervised by a qualified health care provider. So the doctor will monitor the patient throughout the treatment course and manage any side effects that arise. So the standard treatment can cause the standard treatment can cause is usually about 60 days, and the patient takes the medication every day for these 60 days. Completing the full course is very important, and stopping early can reduce the effectiveness of treatment. So there's currently no vaccine for Chagas disease, and scientists are working seriously on developing one, but as of now, nothing has been approved for use in humans. So this means prevention and early treatment remain our most powerful tools. So for people with chronic Chagas disease who have already developed cardiac complications, treatment also includes managing those complications, and and this might mean medication is um, control the heart rate, medicine for heart failure, blood thinners to prevent stroke, or in severe cases, procedures like implanting a pacemaker or defibrillator to regulate the heart. And so, in the most extreme cases of heart failure, a heart transplant may even be needed. Although this brings its own complexities, because the Chagas parasite can reactivate in the setting of the of the immunosuppression required after a transplant. So, um, what can we do to prevent Chagas disease? And I'm going to talk through the most important things of what we as a person should do to prevent Chagas disease. Now, the first is improving housing, because the kissing bug lives in the cracks and gaps of poorly constructed homes like the mold walls, thatched roofs, gaps in walls and floors. So, improving the quantity of housing reduces the bug's ability to live close to people. So, this means plastering walls, replacing thatched roofing with better materials, and sealing gaps and cracks. This is a structural issue that requires community and government action, but it is one of the most effective long-term solution. So the second is insecticide spraying in uh, in, endem- in endemic areas, spraying homes and especially sleeping areas with appropriate insecticide can kill the kissing bug and significantly reduce transmissions. So this has been done successfully in several Latin America countries and has led to major reductions in new infections in those areas. So the third is using bed nets and insect repellents, especially when traveling to or living in endemic areas. So since the bug bites at night, sleeping under a bed net that has been treated with insecticide provide good protection. And the fourth is food safety. Make sure food and drinks are properly prepared and stored. Avoid raw or unprocessed foods in high risk area. Make sure fruit juices and other fresh drinks are prepared hygienically and are covered from insects. And the fifth is blood and organ screening. Every blood donation and every organ donation in an area where Chagas disease is present should be screened for T. cruzi before use. So this is a healthcare system. Responsibility and advocacy is needed. To ensure it is done properly in all relevant settings. And so the sixth is prenatal screening. Pregnant women and women planning to become pregnant who come from or have lived in endemic areas should be tested for Chagas disease. Please be tested. Always go and check if you're having a Chagas disease. So if infection is found, treatment should be offered before pregnancy if possible. So because treatment before pregnancy, is almost 100% effective in preventing the baby from being infected, because I said that earlier. And then please always make sure you go check yourself. In fact, it is advisable you check yourself before getting pregnant. And then the seventh is education and awareness. Now, the more people know about Chagas disease, how it spread, what the signs are, when to get tested, the more people will seek help early. So education is prevention. But what we are doing right now today on this live section, this is prevention. So before I close, I want to talk about stigma, because it is a serious problem that makes everything harder. People with Chagas disease, especially women who have passed it to a child, have sometimes been treated badly. Like they have been blamed, they have been made to feel like they did something wrong. And this is completely unfair and completely wrong. So most people who have Chagas disease were infected through a bug bite. They you know, like they were infected through a bite that they never even saw, like they were never even aware of. So and it's happened while they are sleeping, because that is the only way kiss bug um infect infect someone. It bites you when you are asleep. So it's something that they were never aware of. You know, and some were born with it, or or and also some might receive it through blood transfusion. It's something that they had no control over, and they did not choose this. Like they did not do anything wrong, and so they deserve compassion. They deserve proper medical care and respect. So stigma stops people from getting tested, and so it stops people from seeking treatment because they are ashamed of it. It makes people to hide their diagnosis and suffer in silence. And silence is exactly what the epidemic feeds on. So if you know someone who has Chagas disease, treat them the way you would want to be treated. If you were in their position, with kindness, with support, you know, you treat them with kindness, you support them, you encourage them. You don't have to judge them, because that is how we fight this together. So, everyone, I want to say a massive thank you for staying with me through all of that. Now, let me bring everything together for you one last time. So, 14th being World Chaga Disease Day 2026, the theme is fighting the silent epidemic of Chagas disease. Chagas disease is not a parasite infection caused by T. Spread mainly through, like I said earlier, it is spread mainly through the kissing, but also through, it's spread through food, blood transfusion, organ transplant, and from mother to baby during pregnancy. Like I said earlier on, it has two phases: an acute phase with few or no symptoms, and a chronic phase that can cause devastating damage to the heart and digestive system decades later. So it affects children, adults, pregnant women, elderly people, and people with weakened immune systems in different but serious ways. So it is diagnosed through blood tests. It is treatable, especially when caught early. And many of its most devastating consequences are completely preventable with the right awareness and access to care. Like I said earlier on, 6 to 7 million people are living with this disease right now, and most of them do not even know about it. And that is what makes it a silent epidemic, and silence is what we are fighting today. So, if this section helped you understand Chagas disease even a little better, please share it, put it on your WhatsApp, share it to your Instagram story, send it to someone who needs to know, because every person who learns about Chagas disease is one person who might get tested. who might encourage someone else to get tested, who might save a life. So I just want to say very um, um, I just want to appreciate everyone here for joining me today. Thank you so much for spending your Thursday with me. I love doing this for you, and I'll see you again next Thursday at 3 p.m. Stay healthy, stay informed, and God bless you.